So we have an honor to have with us Dr. Zelenko, and I would like to ask, Doctor, please update us on your fight against COVID-19 and the latest experiences.
Yeah, thank you again for having me and for the opportunity to share my experience with the public. So in my community, the infection rates have dropped significantly, thank God. And we are now in the process of doing IgG antibody testing because we want to establish proof of immunity and also to get a better sense of how many people actually had the infection. A lot of the patients that came into my office were diagnosed clinically because of the poor nature of the PCR nasal swab test. But now we do want to take a look in retrospect and see to confirm that they actually had that infection, and more importantly, to document that they're immune so they could slowly reintegrate back into society, which is really the ultimate purpose. So that's being actively done. And I'm actively involved in publishing my work. God willing, it should be soon. I'm collaborating with two world-class researchers from Germany who have a lot of experience publishing in the best journals in the world. And the idea here is to begin our counteroffensive against the forces of evil. And what I mean by that is there's zero doubt that these medications work. There is almost no concern about the safety profile of these medications. And yet, if you look at the media and you look at the information that is being fed, Joseph Goebbels said, he said, give me the media and I can control a nation of pigs. And in Russia, they used to say that the media is useful idiots. So what the ultimate and the biggest crime that's going on now is that there are certain forces that think that the American public are morons, that we cannot differentiate what truth is and what lies are. So there's very bad people who are doing very bad things. And let me explain. There are drugs that have been developed, newer drugs that are under patent that cost thousands of dollars. And these drugs are being pushed by the medical community and by the politicians to be used. The approach that I have developed, which has reduced death and hospitalizations by 95% and confirmed by data from France and from Brazil and now from Turkey. Just today they published their data that there was a 96% decrease in death and hospitalizations. So there is a big problem for these companies that have invested billions of dollars, because if my approach is scaled nationally and globally, that takes away around 95% of their market share. Also, the President of the United States came out in support of these medications. This is a political hot issue. So what's happening here is there are forces that are suppressing the truth. There are forces that are trying to fool the public for two reasons: profit and politics. The problem is people are dying in the process. It's a horrific crime which is being perpetuated on the American public. So whoever hears this, I plead with you, rise up in a nonviolent way and make noise and begin the grassroots protests until our voices are heard. Because the forces at play here have infinite resources and power. And we are simple people, but the collective will of decent and moral human beings and of goodness will always win. So I plead with whoever is listening to join together and fight for freedom, because we are experiencing tyranny. When non-medical personnel forces come and limit what a doctor could do and how a doctor could practice and heal his patient due to politics and profit, that is tyranny. So from my end, the counteroffensive now is to hijack their own language, hijack their own ways of communication, which is through the science and through the publication of legitimate, solid, bulletproof data, so that there's objective truth upon which policy, solid policy, could be built upon.
I want to confirm that many of our viewers, I'm talking about the YouTube channel, there are hundreds of thousands of people. Or the first interview we had has currently 114,000 views. And many of them were actually questioning the clinical studies, and some of them actually quoted the latest, I believe, Veteran Affairs research, or whatever the clinical study that they showed, and especially the news agencies that have spread the lies that this medication has no effect. But even me, I'm not a doctor in any way, know nothing about it, but I saw that they gave it to basically dying patients, and they did not follow your regimen. They did not include the zinc.
That's the least of the problems. They gave it to patients that were halfway already in the other world, like you said. They used toxic doses. It's very sneaky. They use it in a very narrow subset of very sick patients that have a huge mortality chance of dying. And when the drugs obviously failed, which I could have told them that, then they came and said, and they generalized to say, well, it obviously cannot work anywhere, even for the 50-year-old who has a fever and a cough in the doctor's office and is not yet on the respirator. These are very carefully orchestrated and organized attempt to conceal the truth and to intimidate those people that know the truth and want to help humanity.
I can also testify from our experience. When my daughter got sick, we tried, and one of my friends, doctors, right away, without me asking, he actually prescribed. He called the pharmacy in Brooklyn, and the pharmacy gave my daughter medication, your regimen of three drugs. I developed some kind of symptoms, and he attempted to give this medication to me as well. But by that time, like a week later, the pharmacy refused. And no pharmacy in Brooklyn today, without a written proof or whatever it is of the actual diagnosis of COVID-19 will even give it. And in order for a person to A, develop symptoms, and go B, to take the test and wait another 4 days, it may be too late.
You know what's interesting? These same drugs are currently being used for lupus and for rheumatoid arthritis and for malaria prophylaxis. The same exact drugs at even higher doses. And yet there is no obstacles created for those patients to receive those drugs.
What I'm saying is, to my surprise, In the last week since we spoke, the situation in Brooklyn, New York got worse. It means doctors are more restricted and pharmacies are more restricted to actually give these drugs to the patients.
Do you understand what that means? Do you understand who is restricting? That there are political forces and financial forces tying the hands of people that are trained in the art of medicine, and the tools and the instruments of healing are being taken away. By way of analogy, imagine a surgeon where they take away his scalpel. This is exactly what's going on. It's a crime.
So I think that you're absolutely right by combating them using their own language, and we really will be very grateful if your studies and collaboration with German medical professionals will be published. I think the publication is really very important. I believe that we can also call upon our viewers. Many of them are doctors. And by the way, doctors from all over the world. There were doctors from Pakistan, there were people from Australia, from all over the world. And I think it will be a great support if people will share the information, but we do need some kind of a study. I hope we'll see it soon.
I'm working as hard as I can. And
anything we could do to help you?
Pray. I have to tell you, I'm not a researcher, so I do need guidance. And fortunately, these world-class researchers have guided me. So I have a ton of data. I probably have the most important data in the world in my possession. The problem is that the first study that comes out must be bulletproof, because the whole world is going to try to destroy it. That's the nature of humanity. That's the nature, and maybe rightfully so, of progress. You make a supposition, you make a claim, let the whole world attack it and shoot it down. And if it doesn't go down, you know it's valid. I think that's okay. I think that's normal. But it has to be bulletproof, which means that I cannot use all my data right away. I will be able to use it in several subsequent studies, but let me explain to you why. If I were to publish data, let's say you're my patient and we spoke, you had all the symptoms of COVID, your daughter has COVID, it's obvious you have COVID, so I diagnose you with COVID. But from the scientific community, they're going to say, how do you know? Where's your proof? So I cannot use that yet, but I have a way around it. I'll tell you in a minute. But so I have to limit my first paper to patients that have proven by test objective proof of the COVID-19 infection, which I have a lot of, but not obviously, it's a subset, it's 25%. But there's a acute way around this problem. One of the reasons I'm doing IgG testing on everyone is that is the proof retroactively. Meaning, if the person's immune, the only way they didn't get the vaccine because it doesn't exist. So the only way they are immune is because they had the infection. So that will make available the rest of my data. So that's the process I'm going through right now. So it's going to come out in several stages, my data. I'm going to report on 25% of my data now because I have objective proof. You cannot argue with a lab that shows that you have it. That's how I know. The rest of the patients were diagnosed clinically. I will be able to report and publish once I have IgG data, which confirms that they had the infection, because it documents immunity. And the only way you can have immunity is if you have the infection. So it's a proof. So that's what I'm busy with now. So we have a big van driving around my community, and we're testing everyone in the streets. It's important.
That's the way. And how are your clinical so far results? In other words, you reported that some people unfortunately passed away. There were two. Actually, yeah. My friend in Kiryat Yovel died from Moscow, I believe today or yesterday.
I know who it is. Yeah.
Alex, you know, there was a Russian Jew who died.
R. Last name begins with a R.
Right, right, correct. So,
My patient, he wasn't treated by my practice, but I am aware of his situation, unfortunately.
correct, correct. So a relatively
There
young
were
person.
14 deaths in the community, 4, but only 2 of them were my patients that were treated.
So in other words, since last week, you have no more deaths,
No,
more hospitalizations probably,
no,
not even more hospitalizations.
no.
And so we really so honored to hear your update. I want to thank you so much on behalf of many of our viewers, thousands of viewers. Many of them said, God help you, protect you, and help you to protect American people and humanity. I want to thank you so much for the update. And I hope to hear from you again. Thank you so much. All the best.
Bye-bye.
Thank you.